not have this particular summit without addressing how are you reaching your customers. More importantly, they seem very obvious to find, but they're so not. And what happens is, I think we cleverly target, the ones that seem obvious, but we're not always kind of looking in the blind spots and checking out the markets that we're just not thinking about. So I'm hoping that not only do you get for this particular session, get insights into how to reach the ones that you have better, the ones that you're already channeling and targeting, but also the ones that are kind of maybe not even something you've thought about before. So it's really about opening your minds to new channels and things that we just kind of might be missing. With that said, we've brought to you two people who are exceeding greatly at both of these. And this is going to be a really cool, they're the dynamic duo. So I'm going to start with Silas Buchanan. Silas is the CEO of Our Health Ministry. He's a news junkie. CNN, MSNBC, and Fox all play in the background. Oh my God, I have a headache. All day as he works. And it plays on his Sirius radio in the car. He does still love cartoons and probably watches a few daily and makes sure his kids are getting educated on some of the classics like Snagglepuss, Huckleberry Hound, Quick Draw McGraw, Speedy Gonzales, and Adam Ants. Catherine Calarco is the Chief Marketing Officer and Senior Vice President at HeartMath. She's an underwater videographer who swam with the dolphins and whales. Whales? Sorry, those are big. You have to check out her channel on YouTube for more about that.
All right. Good afternoon. Let's make sure I can figure out how to do this thing. Oh, yeah, I got it. Thank you. All right, so I'm with ourhealthministry.com. We are a patient-consumer engagement and activation firm headquartered in Cleveland, Ohio, very focused on finding ways to leverage technology to reduce racial and ethnic healthcare disparities. We're also very focused on raising HIT literacy, right? We're concerned that there's going to be possibly an exacerbation of health disparities because of technology, not in spite of it. So we've got to solve for that, and I think I'm speaking to the right audience today. The problem that we are also solving for primarily is health disparities, and my demographic struggles with, in market, being underrepresented, uninspired, untrusting, uninformed, largely unengaged, and I think I made up these last two words, unactivated, and thusly unempowered, right? And the factors that drive some of this, in addition to the social determinants of health, education, income, social standing, those sorts of things, lack of trust is quite significant. Lack of culturally competent providers is also significant. I think that African-American male enrollment in medical schools this year is at its lowest rate in 32 years. So we've got some cultural competent issues that we're dealing with. There's a lack of culture-specific health information in the market, and also the inability of public-private stakeholders like many of you in the room to reach this targeted demographic. So this makes it a problem that we're all solving for. And even more so, because according to the US Census Bureau, in the next couple of years, by 2018, 2019, white kids will account for less than half of the under 18 population in this country, right? So solving for this problem of how you engage and activate this targeted demographic is something that we all need to solve for, and it likely makes a lot of business sense as well. Here's a snapshot of health disparities. I really won't read all of those for you, but basically the morbidity and mortality rates of people of color is completely out of skew with the white population, right? And this cuts across socioeconomic status, it cuts across education. So it doesn't matter how much money you have or how smart you are. If you are of color, you get and die of disease in far greater numbers than the white population. And so there are significant costs associated with this conundrum. Again, won't read those. You can read those yourselves. Maybe a couple are pretty glaring. Health disparities increase health spending by $60 billion. I believe these are 2011 numbers. And if we do nothing, the cost of health disparities will grow to $363 billion by 2050. So for us, and I think all of us, the solution to the cost problem begins with engaging and activating patients. And we're entering a new era of patient activation, and we learned quite a bit about that today. What we haven't seen a lot of is strategies to activate underserved and minority patients, which are absolutely critical. And we know that when you can activate us as patient consumers, we're practically free resources, right, to self-manage chronic conditions, it's going to lower the cost of care, right? We'll lower readmissions, more activated patients experience less medical errors, and of course, it improves patient-provider communications. I like what the previous speaker had to say about mobile apps, and for our targeted demographic, mobile apps are critically important. Our specific solution, ourhealthministry.com, is finding ways, again, to leverage technology to reduce disparities by working through the trusted purview of the church, right? We've established some pretty strong relationships with some mainline historically black denominations, and we're doing some things to reach their constituency. Our platform, however, could be white labeled and bolted onto any one of a number of minority consumer-facing organizations to disseminate information and collect data and reach them in likewise fashion, right? So for the faith-based constituency, we'll do some things on the front end to really engage them and to engage the leadership. Prayer circles, online Bible study, that sort of thing. But behind it, we just brought Alere Health on board. I think Alere has been mentioned a couple of times today, to provide some of the back-end solutions so that we have some real robust engagement and so that we're able to share data along the way so that we can integrate connected health devices and collect data, medication adherence support, the things that are driving the costs for this demographic that tend to be driving most of the costs. It's important that we begin to onboard these sorts of interventions. Growth potential inside of this sector for us is pretty significant. We've taken a look at the entire faith-based sector, at least the mainline historically black sector. And so here's a snapshot. The AME Church, as mentioned, is 6,000 congregations, 6 million members worldwide, and the other mainline historically black denominations are fairly girthy as well. So what we've done specifically, as mentioned for AME, is created a sub-portal underneath ourhealthministry.com, and that's amechhealth.org specifically for the AME Church. So we're giving them tools, I should say this too, that of those 6,000 congregations and 6 million members worldwide, 4,000 and 4 million are domestic. And 40% of those 4,000 congregations have a dedicated health minister. So again, here we are with the practically free resources at our disposal to drive interventions in a very credible way, right, into this targeted patient-consumer market that we all should have our minds around and we're solving for. We did a couple pretty interesting things directly for the AME pastors. Faith-based organizations are, ripe, I don't want to call them targets, but engagement partners for social service agencies, the American Heart Association, American Diabetes, American Cancer Society. All of those organizations are driving things programmatically through the church. But when you ask a pastor, how many of your congregants have diabetes? He tends not to know the answer to that question. But he's working with the American Diabetes Association. A simple survey has shown several of our pastors that, well, in your instance, maybe only 5% of your folks have diabetes, but 40% smoke. So let's do some things just a little bit different from an intervention standpoint. It's just important that this targeted demographic have their arms around the data and around the numbers, right? No data, no problem, no money. So, these folks tend not to take advantage of a lot of the grants that are available simply because they can't quantify what's going on, and we're solving for that. So this gives us trusted access. Folks may visit their doctor, 15 minutes a year. Our folks are in church, 70 plus hours a year, right? So it gives us, fairly unprecedented access and trusted and consistent access to this targeted group of folks. So it was time last summer to actually do a proof of concept, and so we did it. We did a proof of concept in New York City with 10 churches, and these churches ran the gamut from very large mega churches. There's Pastor Floyd Flake's church, which is 20,000 members in Jamaica, Queens, down to a 150-member church in the Bronx. And we did this with some public-private partners. Boston Scientific supported us, and in fact, we work on a per member per month model, and they wanted to access 12 to 1,500 of our members, and so we obliged. We also engaged New York City Department of Health, HHS Office of Minority Health, and Welch Allyn was kind enough to drop ship in blood pressure monitors. And so we took blood pressures over 12 weeks. At the same time, New York City Department of Health was running a similar hypertension, campaign in New York with, I want to say, 5 community centers and 3 churches. Over 12 weeks, they engaged 80 people, and we engaged 1,200, with 60% of those people coming back week upon week to get their blood pressures taken. The interventions for us were diet, exercise, and physician referral. In this first iteration, it really for us was just proving to ourselves and others that we can herd the cats. We can get the pastors, the bishops, the health ministers, everybody nodding their head yes and actually making it a call to action. So this effort wound up being written up in the White House faith-based blog, and it's led to us being written into an MOU with HHS, Office of Minority Health, Office of Faith-Based, and the National Partnership for Action in Health Disparities. We're also probably one of only 2 minority consumer-facing organizations that are official Million Hearts members. So, you guys know millionhearts.hhs.gov. I think the idea is to prevent 1 million heart events over the next 5 years. We're part and parcel of that. So this has led to some interesting partnerships. Data capture is critically important. As stated, we didn't collect a lot of data in the first iteration. With the Lear on board, we'll be collecting quite a bit more data as we go, as we begin to ratchet up conversations about how the role we play and community health workers play in the patient-centered medical home and accountable care workflows, right? It's all about reducing costs and cost avoidance, and there is a significant role for our folks, right? So when you want to connect, and we talk about engagement and activation, a lot of this is mandated, right, through the HITECH Act, through meaningful use. We already talked a little bit about ACOs and PCMHs, and our folks are poised to participate actively in that, as well as the health insurance exchanges and the marketplaces. So before we really, got too deeply involved in this whole thing, we want to take a hard look at, how folks are using, particularly our targeted demographic, how they're using broadband, or if they are using broadband, how they're getting online, if they are getting online. This is a study that Pew Research did, and this particular slide shows the percentage of American adults 18 and over who have broadband at home. And as you can see, Black and Hispanics have significantly less broadband at home than white non-Hispanics. It's a significant gap. And so the digital divide still exists, so it's important for us to have both an online and an offline strategy, and I'm happy to chat about that with you guys, maybe off stage. Then we looked at, who does own a smartphone, right? And when we take a look at who actually owns a smartphone, you can see May 2011, the numbers were pretty significant, kind of skewed back the other way. Black and Hispanics, 44% to 30% own more smartphones than the white population, and the numbers still are skewed higher for Black and Hispanics as of February of last year. And the last thing we wanted to look at was the demographic of smartphone users who use their phone to mostly go online. How are you getting online with your device? And the numbers are just striking, right? It's more than double. Black and Hispanics are 38%, or 19% higher, the numbers are, Black and Hispanics getting online than the white population. So when we're solving for this issue, we're solving for mobile, by and large. And I'm out of time just about here, but so when Jill called and said, we want to talk about, patient consumers on and off the grid, it really had us thinking about actually who is on the grid and who is off the grid, and what grid exactly are we talking about? I think on the go forward, folks that are currently deemed to be off the grid will be significantly standing on top of the grid. Thanks for listening, guys. Okay.
Take any questions?
Yeah. Oh, you want to do? Yeah. All right. So I'll do Q&A right now. If you guys have any questions, happy to take them.
Yeah, 2 minutes. Yeah.
Yeah. Sure. There's a mic.
You're doing one, oh, here it is, thank you. Okay, one website, or are you doing a mobile apps, or are you doing a portal that then you could integrate into other church websites? I mean, how are you, I guess I'm kind of not clear on what your delivery system is.
Okay. So right now it is one website with a sub-portal. Right now it's ourhealthministry.com with a sub-portal specifically designed for the AMEC denomination, right? In our model, taking this information disseminating, data collecting platform and white labeling it and bolting it onto any one of a number of minority consumer facing organizations is our goal. So it doesn't matter if it's, La Raza or Esperanza or the Asian American Society or any one of the other faith-based organizations or NAACP or Urban League. All of those organizations have mission around health disparity reduction, but what they don't have is this engine that we can white label and give to them, right? That can then be powered perhaps by some of the interventions that you guys are developing here in the audience. You guys a lot of folks here are solving for, diabetes control, but you don't have trusted and consistent access to this targeted community, and so that's what we're providing.
Cool.
Any more?
Hi, how are you monetizing this?
So, not to give away too much right now, but it's a PMPM model for us. It's a per member per month model for us, right? So what we did in New York and what we'll do again this summer, again with the support of Boston Scientific and Close the Gap, we'll do this in Columbus, Dallas, and Atlanta in the next 60 days or so. They pay us a per member per month fee for us to bring to the table this targeted demographic to be educated around hypertension awareness, prevention, and we'll do monitoring as well. When we kick off this time, however, we'll do some biometrics right from the very beginning, so we'll have our arms around a whole lot more data on the go forward. There's also an ad and a sponsor revenue model as well, so yeah. Okay. Thanks, guys.
Great, thanks. Thank you. I'll just great. Hi, so how many of you guys are in hospital or physician or medical markets? How many people are mainly in that one? Okay. How many people are mainly in consumer? Mostly direct to consumer? Okay, all right, I just want to understand what direction to spend most of my time. Okay, so a little bit about HeartMath. We're a sponsor here, so if you want to get that aha moment, I really want you to check out our Inner Balance app. So that's my commercial, and the rest of it won't be. So we have access to millions of people worldwide in over 85 countries. We have 85% of our people recommend the product to others. So that's a huge amount of referral business. We create this word of mouth movement. 24% are referred by health professionals. So we work with health professionals, we train them, they use our products, and then their clients and their families of clients engage with us. We have a huge social media. We have over 180,000 fans that are very active, very very loyal. And to be honest, they love us. It's really cool. So what we did once with Lost Gadget Standing, there was a social media competition with being able to be the most popular. We were competing against Motorola and large organizations, and we activated our network and said, please vote for us, and we only gave them less than 24 hours to do it. We had over 33,000 votes because these people know us. They're engaged with us. They understand the value, and they're rooting for us to win and be recognized for how we change their lives. We have sustained product growth year on year. We've done partnerships, and we also have used products. Our products are used for more than 2 years. A lot of people talk about, hey, is it sustainable? Is it they get the product and they put it in the drawer? Well, in fact, what we found out through our research is that people use our products 2 years after they've purchased it, more than once or twice a week. So it has become part of their life. So we understand that behavior change. So I think part of it is have that emotional connection with your client base. Understand what is the benefit that you're delivering to them and help them solve their problem. It's not about the technology, it's about the emotional or the physical or the benefit of that individual to work with you as an organization. So really pay attention to what's happening with that. And I really feel it's important to be purposeful. What is the purpose of your organization? Why do you exist? Watch the ads. Has anybody seen the J&J Love ads? Have you seen those ads? You notice how ads are moving more towards telling a story of life and benefit and things that are very authentic. So watch the purpose stuff. Inspire people to be part of something bigger than themselves. Right? People love to help other people, and they like to be part of something. So often we market them not for yourself, but what about for your family? Or we say, take care of yourself first, because a little bit like in the airplanes, you have to put your oxygen mask on first before you put it on your child. Well, we help people to manage that. And meet them where they are. We all hear this. You have to message where people are at and really talk within their language. And we've worked really hard because HeartMath started out as a research institute over 20 years ago. And so to really establish that market credibility, it was our intention to ensure that we had the research, the validation, and the understanding behind what we were providing for people, and then to make it very simple for them. But yet we don't want to always talk to them in that research language or the tech language. And I don't know about you guys, but babies and dogs work. So I think it's important also to understand each other, right? Take the time to build that relationship and know, not just based on what your speculation is, but on true behaviors. If you haven't read the book on unpredictable predictability, the book on behavior economics, that sort of kind of talks to a little bit about this. But I do believe that babies and dogs really help you to connect with people and have a conversation. And it also conveys the message of what that baby's trying to figure out what that dog's about. So I think you have to do the same thing with people in your market. I also concur with the two crews before us who actually talked about making it simple and easy to use. It is fundamentally important to think about what is the customer experience. Put yourself in their shoes and say, how is it going to be easy for us to get that value? Can I learn this in 5 minutes? Can I get the benefit in a short period of time and then be able to be rewarded through things like gamification and one-on-one engagement externally to the product, or things like messaging, notifications, easy training, tips, additional programs? We've also won awards. So that's our product picture there. Take them on a journey. Bring them in and nurture them along. Keep them up to date. Educate them. We do this through email. We also do this through webinars. Our webinars are very successful. And really engage people to tell other people. The most important thing you have to do is make sure this thing works, that it actually does deliver what you're saying, and it doesn't require, in our cases, it doesn't really require a medical physician to work with anybody to make the results happen. And our research is available. One of the key things that we are recognizing is that stories help people understand what you're trying to do. So get famous people to tell the story for you, and because people recognize it as, they're not going to search. People don't want to really search to figure things out, but if they know someone who is credible has checked this out and is talking about how they've used it, or they have engaged with that and are willing to talk about it publicly, that's very important. We also have a lot of customers telling stories to each other, and there's a lot of word of mouth facilitation of being able to say, wow, that worked for me for sleep, or this worked for me for communicating with my kids. And we get profound stories every day. We have something called heart moments, and those moments are like, they bring you to tears on how people's lives have been transformed, and that's very powerful to get people to engage and to stay with you. I also think it's important that you connect with millions of people. Nowadays, it's not okay just to do one thing. You have to look at what is your full integrated point across your marketing and communications plan, and also your sales and your strategy. How do you actually engage with more people? What's your facilitation for that? We have a Facebook page, and we do have a lot of fans, but they're pretty unattached. So how can we engage them further? And we give away things on our Facebook page, and that gets their email addresses and allows them to learn more and understand the webinars and understand what the product does and things like that. So I think it's important to understand the funnel, but also know what people want. And who wouldn't want to play golf better? So we help people to play golf better. Okay. I also think it's the other thing that's really important is to think about how you are connecting with them. Earlier today, they talked about in the physician market about understanding the domain and understanding what is the physician's reality. We work a lot with nurses, nurse practitioners, and people in the office who actually spend more time with their patients to be able to train them on how to use our devices. So think about what is the experience within their office, what is their reality, and how can you fit within that and help them to meet their goals. And I think that's the same thing with partnerships. How can you facilitate a partnership? Often you have to work a little harder, put things together, but the biggest thing is deciding who you work with. Who is going to provide value? What is your shared intention and mission? And how are you going to drive that outcome together, knowing what each other's strengths are, what each other's weaknesses are, and how you're going to fill it? So partnerships are fantastic, but what's important is to mutually identify how to truly get a benefit out of that. We partnered with Huffington Post with Ariana's GPS for the Soul last year, and we get hundreds and thousands of names a week from people who are interested in HeartMath and want to learn more from that exposure. So I think it's really, and also understanding what it is and also what it is not. So it's really important. And I think people really do want connection. You know, they want to know how can you help them, and be very clear and make that stepwise to get there, make that very clear for them. So that's sort of my PowerPoint side, and I really wanted to open up to have a conversation because it's a little quiet out there, and I think there's a lot of questions. So I'd like to open it up and ask if there's any questions from the audience, and I'm happy to ask anything about any of the market segments that we're in. Yes, go ahead.
I was curious, and thank you for the presentation. It was excellent.
Thank you.
What is the baseline product? What is the product?
See, now there you go. Right, I didn't. That's a perfect question, right? So I made you the intrigue. Basically gets people to ask the question. So the idea, our product is called Inner Balance. It's a mobile app. It has an external sensor that's an infrared sensor measuring heart rate variability. What we do is help people manage their response to stress. So what people don't realize is that their physiology responds to things like emails as if it was a tiger. And an email is not dangerous. So why should your heart rate go up, spike, your internal physiology go chaotic in response to an email? So what we train you is to disintermediate that fight-flight situation by using both a monitoring device, either the M-Wave technology or the Inner Balance sensor with the iPhone, to help you see that in real time. And then our tools and technologies enable you to shift in the moment and reset your physiology. So when you're stressed, your heart rhythm looks like this. It's an earthquake tracing. It goes from 60 to 90. Your heart rate will go from 60 to 90 to 120 to 100 to 150. And that's not healthy, but maybe you need it if you're responding in a fire in the middle of the night. What we train you to do is to shift your physiology such as your heart rate will go from 60 to 80 and back down again in a nice smooth pattern. And that smooth pattern is called coherence. And we train you how to feel that and how to actually train your body to get into that state. And what that does is it synchronizes your breathing, your heart, and your brain. And that synchronized state is coherence, where you are your most calm and aware, have a highest cognitive function. And it is, through our 18 years of research, the state of love or appreciation. And who wouldn't want to feel appreciated more often during the day? So that state is where you can create as a baseline. So that's what we train. It's the M-Wave technology, inner balance technology, and we have associated training programs for individuals and health professionals, and you can check us out at the booth. Thank you for the question. Anybody else?
Question over here.
I really liked what you said about, you said emotion is the most powerful force driving consumer behavior.
Right.
Totally agree with you. Thought it might be helpful if you could share some example and maybe talk a little bit more about how you have used emotion to get people to adopt and continue to use your specific product.
Absolutely. The key thing is messaging. How are you communicating with them? Are you communicating from a benefit, or are you engaging with them on a tech level? So in our education process, sometimes we have to go tech to understand what the science is behind HeartMath. But in the second way, what we do is we talk to them as got stress, or looking, live healthy, feel better, live better. HeartMath moments. We have this moment of a cardiac patient who worked with his doctor, and in almost tears talks about how HeartMath and his doctor saved his life. And so you tell that story, you're emotionally connecting with people. The second thing is you've got to build trust. Trust is an emotional engagement. In the end, people will push that buy button because they trust you and they feel it's right. So what we do is a lot of work on conveying that trust. And also the people in our company are all heartful. Our culture is about care. So that is conveyed. So people go, hey, this is a good company. They're not going to rip me off, and they're very credible, and so I trust that, and I feel good about that buy. Now, to keep them there, we give them what they need, what they look for. We do a lot of measurement. We test a lot of things in terms of what people are looking for, what they engage in, and we define what the metrics are that we want people that have to do with that behavior and emotion. Inspirational news on our Facebook page is really popular. We grew a lot of fans by having inspirational news. People, surprisingly, good news does sell. You think that the media wouldn't know that, but it does. So we had a lot of fans engaged because we were telling hopeful messages. Inspiration does well. So those are kind of the things that we've done, and hopefully that's answered your question. Happy to talk about it more later. Any other questions?
I actually have one question, sorry,
Well,
since we have time.
Oh, there you
Sorry,
are. I'm
over
like,
here.
where are you, this
Since we have
disembodied
time.
voice? It's Jill.
I'm interested. Well, I'm fascinated by the whole identification of the market and identification of your target market.
Yeah.
And so I'm interested to understand, how do you, what was your biggest challenge in reaching your recognized market, and were there surprises along the way?
Good question, because stress is ubiquitous, right? I mean, how many of you don't feel stress? So it's the center of behavior change. In my view, it is very much a fundamental part of disease management and prevention, and also bettering people's ability to function in life. So managing their emotional response to stresses around them will change their life. So really what the challenge for us was, wow, you could go anywhere. You can literally, I mean, we're in corporations, we're with medical, we're with health professionals, consumers. And what we started to realize is it really was less of a vertical domain segment as it was a state of a person, right? And so the two people that we really were seeing were people who were in a pain state, who actually had challenges with stress. We're recognizing it as a problem and we're in need. They were often, women are healthcare managers. I think a lot of you know that. The women are the healthcare managers within their families. And often the women would recognize immediately that they needed to do something and would be the first person to adopt our product. So women between the ages of 40 and 65, they tended to be slightly more educated. They are recognizing that they are stressed. They or their husbands may have been referred to from a health professional, and they need to do something about it, and they're looking for a solution. So that's really what we targeted, and we created our persona. I heard that earlier. We created our persona. We called her Ariel, named after my little puppy. And then the second client base is really people who are on the journey, who have recognized in order to prevent to create a better life for them, that's their insurance policy. So what they're looking for is, how can I live better for longer? How can I improve my health, my capabilities at longer? or also how can I make a difference in this planet by being a better person. So they tend to be more on the empowerment track, on the Better Life track, their LOHAS group, and they are very personally like spiritual and motivated. So those are the two audiences. And frankly, all of those people exist across the base. Now we've focused it primarily on the consumer and health professional because of that dynamic referral a cycle that occurs. And we're also within the hospitals across as caring for the caregivers to create more of a healing environment and outcomes within hospitals. We're in Kaiser's and Mayo and Cleveland Clinic. So we've tried to narrow it down. That's why we're partnering, because we know a lot of you are excellent in your areas, and so we are actively knowing that in order for us to grow, we need to partner. So we're looking for the right people to partner with, and many of you are here. So we look forward to working with you. Thank you for the question. Thanks.